Karen, I wonder if you could introduce yourself and tell us a little bit about the work you're doing.
Sure. My name is Karen Lawson. I'm a recovering physician. I have been in the field of integrative and holistic healthcare since the mid-90s and have really evolved my interest from holistic medicine as an endeavor of changing the healthcare system into an interest in health coaching. As I've recognized that I think we need a bigger, broader impact of ways to change the system of healthcare or the system of disease management that we have. And so my passion really for the last 6 or 7 years has been developing, expanding, and forwarding the field of integrative health coaching as a way of providing a new kind of professional in the system that we have that can really work side by side with individuals and how to intentionally make belief and behavior changes that impact their health. Because I think consumers today, all of us, and we're all consumers, you go see either your regular doctor or you go see your chiropractor or your acupuncturist or your naturopath, and all the experts tell you what to do. And then you go stand in the parking lot and go, okay, now I know all the things I should do and I have no idea how to actually do them. And so I really envision the health coach as being the person that can work side by side with someone and going, what's important to you, what do you value, where are you now, where would you like to be, how do you want to get there, what kind of support and resources do you need to make it happen? Because I think that the way that we're looking at health and well-being in this country now is so important, in the fact that really 90% of the determinants of health are things that we all individually do ourselves. They aren't things that happen in the doctor's office, and I think health coaches can be a way to make that happen.
Do you find the healthcare system to be receptive to this kind of training?
I think the healthcare system is recognizing the fact that there's huge gaps and recognizing the fact that there's certain things that we've done for a long time that just aren't working. I mean, despite the fact that, pretty much everybody knows that smoking's probably not a great idea and that eating Big Macs 3 meals a day is not your optimal nutritional diet, that doesn't change the fact that we have still a rampant, epidemic of obesity growing every year. So it's like, even though we have all the information we should have, and with the internet everybody has tons and tons of information, information alone doesn't result in behavior change. So I think that even the real hardcore conventional system recognizes that certain things that we've been trying to do with case management, disease management, nurse-based health education, a lot of those initiatives have only been so effective, and that there needs to be something else. And I'll tell you, the group that we have the largest conversations with are probably employers who are paying a big chunk of healthcare cost in the United States. And they're saying, we don't care what it looks like, we don't care what it is, we just want something different that will help decrease our costs for taking care of our employees. And health coaching is a really natural fit to bring into on-site employee health and wellness programs. And the really positive thing is it really is empowering. It's about empowering the individual and the family groups and culturally to make different decisions. And so then I think that people can really impact even broader layers of their life than things that they normally niche in health, to really think more broadly about, well, how do I really thrive in my life? So so it's exciting, and more and more, even the medical home movement, accountable care organizations, they all have a curiosity about what this health coaching thing is. How can this accomplish something that other things haven't? How can this change things for us? Is it going to be a money-saving proposal kind of thing? And health coaching was actually written into the healthcare reform bill last February, although what I have heard from the Surgeon General's office is they're not sure that they know what it is, but it's in the bill, so we now need to figure out how to implement it. So that creates lots of wonderful opportunities.
Interesting.
Yeah.
And do you have a sense for how health coaching is received globally?
It's interesting. We had a summit in September of 2010, so just about not quite 2 years ago, in which we drew together leaders in the field from all over, or from specific areas of healthcare that might have interest in the field. And we had about 75, 80 participants. And we did have representatives from Australia and Israel and Canada, interest from Germany. So coaching, particularly more from the life coaching and executive coaching base, has been an international movement for the last 25 or 30 years. And there is a lot of interest in health and wellness coaching nationally. And part of the challenge now is when people from other countries want to be at the table, in developing the field, so many of the issues are based upon our healthcare system and where it would fit in the system, that it's not a natural conversation because they're all dealing with different systems in different countries. So conceptually, from the field, there's a lot of common interest, and we meet each other and we're at educational conferences together, but from an implementation in our individual countries, we each kind of have unique challenges in front of us about how we're going to make that happen.